Hi, this is Dr. Mary Powell. I'm going to be talking to you today about uh, something new and wonderful that is beginning to occur in social work education, and that is paid internships. But before I talk about that, I want to say something. I'm going to go to the individual now and out of the system. A big part of burnout, individual burnout, is it's associated with procrastination. And perfectionism is a major cause, if not the cause, of procrastination. Now, students, and everybody, you're overloaded with stuff. So sometimes it's a good idea to procrastinate on some things. But often we procrastinate because we're exhausted and burned out. But we also, if we believe that we don't have to do things perfectly, because we've been taught in various ways that we do, we're more likely to get them done quicker. So I'm bringing this up because look at me today. I'm wearing a sweatshirt. This is my day off, not day off to relax because I would never be doing any kind of work. My day off from patients, and I get to be in my home office and get things done, basically. Patient related, my writing and book related, and personal related. I absolutely love it. Now, I'm wearing my sweatshirt because this is what I wear on my days off. Now, when I've done a few videos like this before, I was dressed professionally. The first video, I was wearing like a suit outfit. I told myself as I was getting some other things done, okay, you're going to do the YouTube video, so just go get dressed, wear something nice. And I said, no. Okay. A reason we're not moving forward in a more rapid way is because we think we have to do everything perfectly, that we have to be ready. This has to be done, that has to be done, and then we don't move forward. I have a lot to do. And I realized I don't have to be ready. Sometimes we think we have to be absolutely ready. Everything has to be ready. And then we get nothing done or we procrastinate, we lie down on the couch. And today I decided the thing I wasn't going to be perfect with is what I'm wearing. No lipstick. Look at these ridiculous rings. I only wear them on my days off. I'm not going to wear them in the office. Look at this. Look at this. This is a replica of Princess Diana's engagement ring. Look, this is a fake 8-carat engagement ring because I was curious about what that would look like. I've had a huge engagement ring and an angel ring from the church next to my university. That's right. I left it all on. This is a very cheap necklace. I think that the message that I have to give you is much more important. I think it's wonderful. And so it doesn't matter what I'm wearing because I think that what I'm going to say will make up for this. Okay? This is Anaheim from it has lint all over it. I'm so proud. Okay? If we tell ourselves whatever I have to get done does not have to be perfect. I have a thing, I got this from an organizational website. Some of you may know of it. When I say this, I do something called I shine my sink at night. Okay. I just take a wipe, put some water on it. Okay. But I don't feel like doing it. So remembering that I never have to be perfect. If I see a piece of food in the sink still there, I'm like, no, I'm leaving it there. Never tell yourself something like, if you're a procrastinator, I have to clean my room, I have to get my paper done. That's when you procrastinate, looking at the end product. That's when we procrastinate. In DBT, we talk about something called embrace beginnings, or at least that's what a DBT colleague said to me. It may not be fully from DBT. See, I didn't know, so I don't have to be perfect. In other words, if you don't feel like getting up, I don't have to achieve anything today, actually. But what I will do is go like this. And this is the whole world right now, by the way. Embrace beginnings. There is nothing coming next. Oh, and then I think I'm going to go like this. Maybe I'll sit like this for like a minute. And oh, maybe I'll scooch to the edge of the bed. Do you see what I mean? We're taking little steps, baby steps. It's cliche, but that's the way to go if you want to get things done. If you really want to get these things done, you have to look at the little steps, embrace the beginning, forget the end product. Okay. I could go on and on and on about this, but part of burnout is procrastination, and what causes procrastination is perfectionism. Students, I love you. With all due respect, stop emailing me and asking me for an extension on your assignments because you think it's not good enough. I've had instances where students have emailed me and said, "Can I have an extension?" Sure, I'm happy to give you an extension. But late papers do not receive an A. That's the policy, just to be fair to everybody. Oh, okay, professor, I think I can get it in on time. I've had students who, just a few, who've handed in their paper late because they thought it wasn't good enough. And then I would get it late and the thing looked like a freaking dissertation. It was gorgeous. I was like, I remember saying to a student, you could have handed it in on time. It would have been fine. And now you've gotten some points off. Okay? You're going to move forward when you realize because you're not ready, just because you're not ready, whatever that means, people who move forward in life or famous even, they realize, you know what, I'm not ready. I'm going to do it anyway. Okay. I'm going to talk today about paid internships in social work field placements. It drove me crazy for so long that social work students don't get paid in their internships and in other professions too, but mostly women's professions, because we're taught it's okay and we tolerate it because we really think it's okay that we're paying our dues. It's just an internship. We don't have the degree yet. Okay? Now, if you're thinking about your first placement and wondering, will getting paid make this easier? And the short answer is yes, it helps. You deserve it, as we all do. It's about time. Getting paid validates your skills. Of course, it reduces financial stress, and it makes your time and effort feel respected. But here's the truth. Paying students is not enough to prevent or treat burnout. Burnout is a systemic issue, and even well-paid professionals can experience it. Now, paid internships matter. Yay, schools, I can't say it enough. I'm very happy. I'm not saying I'm not. But paid placements are an important step forward because they're going to reduce the financial strain. They're going to let students focus more on learning. We're recognizing the labor and the fact that social work is a profession. Okay? And it's going to make placements feel fair or more fair and more equitable. Okay? And for students, being paid can feel empowering. For programs and agencies, it is a sign that they value and respect students' contributions. Paid internships are a big deal, and students and all of us should absolutely celebrate them. But while pay is a critical step, it doesn't address all the challenges that students face in their field placements. Okay, so pay isn't enough. Burnout still happens. Even with pay, students and professionals face challenges that lead to burnout. Burnout, as I've said, is not a personal failing. It, it's a normal response to high stress environments. And again, we see this in practice all the time. Plenty of professionals are well paid and still severely burned out. I have a number of patients who are teachers and nurses, and oh dear God, they are so burned out and so miserable, despite the fact they're getting now a great salary. Teachers, it's gotten better. And it's the system burning them out. I feel terrible. I want to help them. And I often help them the most by educating them on the fact this is a women's profession and it is the system. So we can talk about exercising, sleeping, you know, still going to be burned out because of the system. I feel that a decrease in burnout will occur when people are aware that it's systemic. It's not hopeless. Okay. Women dominated fields like social work and nursing and teaching. These are careers where emotional labor is high, expectations are intense, and systemic support is often lacking. And burnout can show up in different ways. There's Maslach's three symptoms: emotional exhaustion, cynicism with patients, with clients, depersonalization, we call that, and a decreased sense of personal accomplishment. Okay, so it can show up as feeling emotionally drained at the end of the day, becoming detached or distant to cope with the stress, questioning your own effectiveness. Paid internships help with financial stress, but they don't automatically fix one of the biggest predictors of burnout in students and social workers. It doesn't fix role ambiguity. It doesn't fix emotional intensity. It doesn't fix lack of structured support. Okay, so that's why schools and programs can't assume, not saying they are, but we can't, that pay alone protects students from burnout. So, how to make the most of paid internships? If you're a student, here's what you could do to thrive even in high stress environments. Okay, your placement. So, if you can, get clear on your role and your responsibility early so that you know what's expected. Not that it is on you or should be on you to have to do this. But if you're not getting it, if you can do it, you may have to do it yourself. Seek reflective supervision if you can, and make sure you have time to process emotional challenges. Process. Supervision should not just be about reporting. If you can, build peer support. Social support has been found in some studies to help burnout. And yet I could tell you this: connect with your cohort, share strategies, debrief together. But if that feels like an extra thing to put on your to-do list, so ideally, if you can, build peer support. If you can, practice self-awareness. Notice your emotional responses so you can address them before they become overwhelming. These are some things that can help you feel more grounded and less burned out. At the same time, I could give you many suggestions, and so could others, about being a better clinician, taking care of yourself, and yet having extra things to do can also, even these things can burn you out. That's why I'm talking about, little steps, little tasks. To programs and agencies, paid internships are just the start. They also have to provide clear learning agreements and structured expectations. You want to ensure that supervision is meaningful and reflective. A good relationship, an enriching relationship with your supervisor will decrease burnout. Please facilitate peer and cohort-based supervision to reduce isolation. And integrate survival skills into the curriculum. The one I recommend is the evidence-based treatment, dialectical behavior therapy. Not just for therapy and for clients. You can teach it to professionals. These are skills that directly target burnout much more than general self-care that we discuss. And when pay is paired with these kinds of systemic supports, students are much more likely to thrive and less likely to experience burnout, or at least severe burnout. So this matters. Here's the bottom line. Paid internships are fantastic and crucial and necessary. They're doing professional work that others that graduated social workers are doing. They should be paid, plain and simple. But being paid for the internship is not a cure-all. Burnout is a predictable response. It's going to happen to high stress placements if systems are not designed to support students. And I talk a lot about students, very much on their side, but this isn't just about students. It's about a broader pattern across helping professions for all of us in this in social work. It's for everybody. Okay, even experienced, well-paid professionals in social work, teaching, nursing, they experience severe burnout when emotional labor is high and support is low. The solution is systemic. That's our specialty, right? Systems for this too. Pay helps, but programs, agencies, and curriculums have to provide clear expectations and boundaries, meaningful supervision, peer and cohort support, and finally, any therapeutic skills training to use on the self. We can teach them things like DBT and other therapeutic methods to target burnout. When students are paid and supported, excuse me, then field placements become learning environments. They become learning experiences that prepare them for their careers rather than draining them before they even start. Paid internships are a step forward, but true prevention of burnout requires building the right system around them. So thank you for watching. I hope this was helpful, and take good care.